Intro.
Before we begin, if this is the first time you visit to our channel, you consider to subscribe. Trust Doctor Channel. Dr. Abid El Wahed. Bulimia is an eating disorder and mental health condition. People who have bulimia go through periods where they eat a lot of food in a very short amount of time, binge eating, and then make themselves sick, use laxatives, medication to help them poo, or do excessive exercise, or a combination of these, to try to stop themselves gaining weight. Men and women of any age can get bulimia, but it's most common in young women and typically starts in the mid to late teens. Symptoms of bulimia. Symptoms of bulimia include eating very large amounts of food in a short time, often in an out-of-control way. This is called binge eating. Making yourself vomit, using laxatives, or doing an extreme amount of exercise after a binge to avoid putting on weight. This is called purging. Fear of putting on weight. Being very critical about your weight and body shape. Mood changes, for example, feeling very tense or anxious. These symptoms may not be easy to spot in someone else because bulimia can make people behave very secretively. Read more about the symptoms of bulimia and warning signs in others. Getting help for bulimia. Getting help and support as soon as possible gives you the best chance of recovering from bulimia. If you think you may have bulimia, see your GP as soon as you can. They'll ask you questions about your eating habits and how you're feeling, and will check your overall health and weight. If they think you may have bulimia or another eating disorder, they should refer you to an eating disorder specialist or team of specialists. It can be very hard to admit you have a problem and ask for help. It may make things easier if you bring a friend or loved one with you to your appointment. You can also talk in confidence to an advisor from the Eating Disorders Charity Beat by calling their adult helpline on 0808-801-0677 or youth helpline on 0808-801-0711. Getting help for someone else. If you're concerned that a family member or friend may have bulimia, let them know you're worried about them and encourage them to see their GP. You could offer to go along with them. Read more about talking to your child about eating disorders and supporting someone with an eating disorder. Treatment for bulimia. You can recover from bulimia, but it may take time and recovery will be different for everyone. Your treatment plan will be tailored to you and should take into account any other support you might need, such as for depression or anxiety. If you're over 18, you'll probably be offered a guided self-help program. This involves working through a self-help book, and often includes keeping a diary and making a plan for your meals. You'll be supported by a therapist during this process. You may also be offered cognitive behavioral therapy (CBT). If you're under 18, you may be offered family therapy as well as CBT. Read more about treatments for bulimia. Health risks of bulimia. Bulimia can eventually lead to physical problems associated with not getting the right nutrients, vomiting a lot, or overusing laxatives. Possible complications include feeling tired and weak. Dental problems. Stomach acid from persistent vomiting can damage tooth enamel and also cause bad breath, a sore throat, or even tears in the lining of the throat. Irregular or absent periods. Dry skin and hair. Brittle fingernails. Swollen glands. Fits and muscle spasms. Heart, kidney or bowel problems, including permanent constipation. Bone problems. You may be more likely to develop problems such as osteoporosis, particularly if you have had symptoms of both bulimia and anorexia. Causes of bulimia. We don't know exactly what causes bulimia and other eating disorders. You may be more likely to get an eating disorder if you or a member of your family has a history of eating disorders, depression, or alcohol or drug addiction. You have been criticized for your eating habits, body shape or weight. You're overly concerned with being slim, particularly if you also feel pressure from society or your job, for example, ballet dancers, jockeys, models or athletes. You have anxiety, low self-esteem, an obsessive personality, or are a perfectionist. You have been sexually abused. Binge-purge cycle. Bulimia is often a vicious cycle of binging and purging, triggered by things such as hunger, sadness or stress. You may set very strict rules for yourself about dieting, eating or exercising. Failing to keep to these then leads to periods of excessive eating and loss of control, binge eating, after which you feel guilty or ashamed. You then purge to get rid of the calories, leaving you feeling hungry again, and the cycle continues.